Welcome to the American Institute of Healthcare Professionals video on anxiety disorders and stress management. And in this short video, we're going to look at what anxiety is, what causes it, and how we can better respond to it through stress management and other modalities in itself. Now, anxiety can be something that is not correlated even with a particular stressor. That's the one thing that makes anxiety different than stress. Anxiety could be something that is entirely indifferent of the situation itself. One can feel out of sorts simply by an imbalance within a particular neural transmitter. Now, that doesn't mean that one cannot feel anxious related to a particular stressor. This will cause an overreaction to the particular situation and cause one to feel in an anxious mode for quite some time beyond the actual stressor itself. So anxiety and stress are a little bit different in regards to that. Anxiety is usually something that is not related to a stressor, or at least its correlation and level of intensity is something that is well beyond what the stressor should be causing itself. Ironically, anxiety is one of the most common mental health issues that individuals face, but one of the most ignored. So there are many individuals going through anxiety that are untreated because of mental health stigma itself. The good news is it's one of the easiest things to fix, sometimes through a combination of counseling, medication, or stress management itself. So through utilization of counseling and coping strategies, one can learn to better respond and react to anxiety. Now, there are a couple types of anxiety disorders that are listed within the DSM-5. The general anxiety disorder, known as GAD, is one where individuals are anxious, maybe due to their own genetic disposition or neurotransmitter issues, and they just feel anxious. There's nothing going particularly maybe wrong in their life. Social anxiety disorder, or SAD, deals primarily with anxiety in social settings. So these types of individuals will have a hard time maintaining composure in a public area or in meetings or anywhere where there's a congregation of people itself. And then there are also panic disorders, where an individual can go into an extreme fit of panic and fear and anxiety, almost due to nothing, or perhaps a trigger that creates a response that is far from correlated to what the trigger is in itself. So the intensity will not equal what caused it. Closely associated with anxiety, we see individuals with OCD, or obsessive compulsive disorder, hoarding disorders, various phobias, past traumas, and of course, post-traumatic stress disorder, or PTSD. So all of these things also play close roles with anxiety. So as we stated earlier, anxiety can be caused simply by genetic makeup and an imbalance within the neurotransmitter being transferred from one neuron from the next within the synaptic gap itself. Anxiety can also be caused by factors of having multiple stressors in one's life. These stressors could be past trauma due to abuse or assault, or traumatic loss itself. And again, the trigger at the moment is not correlated to the intensity of the anxiety itself, but it can trigger an extreme reaction. Or in some cases, it could just exist without a particular trigger or stressor manifesting at all. So anxiety is something that can be lessened or increased due to one's own temperament, one's own coping systems and abilities, one's own health, and one's own support systems. Those who suffer with temperament that is unable to maybe manage anxiety as well as another, or those who have low support systems, these types of individuals will succumb to anxiety a lot easier and have a harder time dealing with the anxiety itself. Anxiety can cause numerous levels of physical, mental, emotional, spiritual, and social distress as well. And if the stress caused by the anxiety is long term, well, then the body is responding to a fight or flight type response. And in doing so, cortisol is being pumped into the blood system, which prepares the heart and the body for stress and trauma, or stress and activity that's going to require one to act or fight. So naturally, the heartbeat is going to go up, the blood pressure is going to go up, and this will affect one's body over the long term in a negative way. So it's important for physical health to address anxiety, but it's also important to address anxiety for one's own mental health, because it can cause individuals to go into social withdrawal from life itself, because one is simply just too neurotic or fearful to be in public, or for that matter, to deal with daily life itself. The anxiety cripples them. It keeps them in their bed. It doesn't allow them to wake up and take a shower and to begin life itself. So it's extremely important to treat anxiety. So in understanding the importance of mental health, it is important for individuals not to feel stigmatized that they have anxiety issues, but instead to find the appropriate help. Treatments are usually a myriad of both behavioral and pharmaceutical in terms of helping one deal with anxiety. From a behavioral standpoint, counselors can use CBT, or cognitive behavioral therapy, and this helps individuals reimagine their situation and to reevaluate from an intellectual standpoint how the situation really relates to them, and how the emotional and behavioral response to that intellectual trigger is in correlation to reality. So sometimes it is good to reevaluate what is causing the anxiety. And if one is feeling this particular type of anxiety, can sometimes a little bit of cognitive behavioral therapy help ground the individual. This doesn't necessarily mean that it's going to make the feelings completely go away, but sometimes it can help give the person some reality to help them better understand the situation that is occurring. And the same holds true for past trauma, when trauma causes anxiety. In counseling, it's important to discuss this past trauma, and maybe that is through exposure therapies such as EDMR or other types, where an individual looks into the past and experiences that anxiety in a safe room with the counselor, and is then able to better understand why one is feeling a certain way, and then try to lower that anxiety gradually. And this also comes into play with other holistic modalities, such as hypnotherapy, EFT, and meditation, which all attempt to calm the person. So instead of being in that fight mode, it helps the individual to enter into a more peaceful mood. So instead of the sympathetic system being activated through stress, these modalities hope to activate the parasympathetic system, which calms the individual. And in many ways, in calming oneself, one is able to come out of this type of anxiety attack that an individual is going through. And these are all things that are discussed or practiced within the confines of the counseling room itself. Counselors, in addition to alternative modalities and CBT, can also teach their clients how to better cope when anxiety strikes, and to teach some basic stress management skills to reduce stressors that might trigger anxiety itself. Now, in addition to the behavioral, I mentioned that there are some pharmaceutical modalities that can be utilized. One pharmaceutical option for their client is an SSRI, which could also include a Paxil type drug, which not only helps with depression, but also helps with calming an individual who has higher levels of anxiety. In addition to SSRIs, Ativan or Xanax are also commonly used for those with anxiety. However, it should be warned that Xanax, more so, has very high addictive qualities. Ativan has the same qualities to addiction, but it's sometimes a little bit more gentler than Xanax itself. Regardless, if you are an individual looking for a pharmaceutical help, a pharmaceutical cure for anxiety, do not self-medicate. It's important to consult your mental health professional who then can work with your primary physician or a psychiatrist who can then prescribe the proper dose and medication that you need. In addition, if you are taking various holistic remedies that help with anxiety, it's important not to mix them sometimes with various pharmaceuticals because they can cause a dosage to be doubled because they might share common ingredients. So if you are using a particular herb that calms anxiety, make sure that it can be used in unison safely with any SSRI or any type of anxiety type based medicine such as Ativan or Xanax itself. Here at AIHCP, we offer a stress management and a crisis intervention program, a certification that is offered to behavioral health professionals who are able to help individuals within the scope of their practice in stress management and as well as in crisis intervention. Below is a link for stress management as well as crisis intervention. Our phone number is 330-652-7776 and our email is info@aihcp.org. If you're a person that suffers from anxiety, don't hold back. Don't feel stigmatized. It's the most common mental health issue that individuals face. So instead of just trying to deal with it, get the help you need, and you'll find that the solutions are very simple and easy, and you'll be able to better cope and deal with anxiety itself. I'd like to thank you for listening and also have a good day.